What do you think when an athlete, usually a male, gets struck in the chest with a baseball and then collapses? Check out this case to see what happens. So here's the case. This was a 21-year-old male. A status post witnessed cardiac arrest while playing baseball. Now, he was actually batting when he was struck in the chest by what was described as a fastball, and he had a witnessed collapse. Now, thankfully, an AED was available on the field. He received immediate CPR and was shocked once and regained consciousness. And on arrival, he was mildly confused, had no chest pain or any other complaints, and his vital signs, well, they're pretty much within normal limits. The ECG in the ED was obtained, and here it is. So go ahead and stop the ECG video here and take a look at it and see if you can come up with an interpretation. Now, if you look at it, it is, the rate is 132, so it looks like tachycardia. There are P waves here, which is reassuring. The rhythm is regular. The axis, limb lead 1, 2, 3 are upright, and AVL is isoelectric, so it's pretty much a normal axis. The intervals, they are pretty much within normal limits. There's normal QTC, which is always a good thing to see. And the ST segments, there are ST segment elevations in AVR and V1 that are pretty non-specific appearing, and there are depressions in leads V4 through V6. And look at the T waves. They're inverted in the precordial leads, in the right precordial leads especially, highlighted there. And the Q waves, we always look for Q waves that are pathological. There are none really, so that's a nice thing to see. No evidence of LVH, no abnormal sort of other Q waves or other kinds of abnormal wave formations. And there are no real significant blocks here. So the interpretation is essentially normal sinus rhythm or sinus tachycardia, actually, with non-specific ST T wave changes here. The clinical diagnosis, this is essentially called Commotio cordis, which is a sudden cardiac arrest after an injury, a sudden impact at a very specific location of the chest wall at a very specific time frame of the cardiac cycle. Let's take a look at this now. This occurs typically in young male athletes, classically described in patients and kids who play baseball, but is also seen in a variety of other sports like lacrosse and basketball, where there could be an injury to the chest wall suddenly. The mechanism, there's a focal trigger. There's a sudden strike of the anterior lateral aspect of the chest wall, and there seems to be a membrane stretch that activates the potassium ATPase channels and then increases the potassium current across the myocyte cell membranes. And if you look at the pathophysiology, keep an eye on the ball here. There's a sudden impact of the ball on the chest wall, and that causes a focal ventricular depolarization within a very specified, very confined time frame of the cardiac cycle. And that goes on then to produce a rapid increase in intracavitary pressure that causes a stretching of the cell membranes, and that stretching actually causes activation of the potassium ATPase channels, which then amplifies the depolarization effect of the cardiac myocytes. And all this, all this has to occur within a very specified, a very limited time frame known as the window of vulnerability, which is essentially about 30 milliseconds, prior to the peak of the T wave. Now, prior to that, you have the absolute refractory period where cells can't be depolarized, but within this, window, some cells can be depolarized that causes activation and depolarization of the cells, leading to this concept of VFib arrest. So that's it. Commotio cordis in this case, in this patient. I hope you enjoyed it. Thank you so much for joining me. Until next week, this is Serge. So long for now.